afternoon, good evening, and good morning to all participants who are joining us today. It is our great pleasure to be hosting a side event during the Commission of Social Development 61 on ICTs, Information and Communication Technologies and Older Persons, Healthy Aging in a Digital World. We are very thankful to our partners, the Mission in New York, Mission of Japan in New York, WHO, UNDESA, and GCOA, who have made it possible for us to organize this session. So in a few minutes, we will start the session. However, while we are waiting for all the remote participants to join in, we would like to invite you to watch a WSIS Forum 2023 video that will give us some time for the remote participants to register and join us together for this session. I'd like to invite the WSIS team to play the video, please. Thank you very much. I would like to again welcome all the participants with us. We have around 50 remote participants who've joined us. So good afternoon, good evening, good morning, in whichever part of the world you're joining us from. So ICTs and older persons was recognized as a very important topic within the World Summit on the Information Society framework. And since then, we've been working with all stakeholders, with governments, private sector, civil society, academia, UN agencies, to ensure that it is a theme that runs across the whole gamut of information and communication technologies, across all the WSIS action lines, ensuring that ICTs can have an impact on healthy aging. And of course, it's inclusive in a digital world, aging in a digital world. So we've made attempts to have hackathons on the topic, prizes on the topic. You will hear from the winners of our previous hackathon, Healthy Aging Innovation Prize. And we've got together a panel of experts who will be talking more about the work that they're doing in the different sectors and different areas of work. Without any further delay, I would like to invite the director of the telecommunications, ITU's Telecommunication Standardization Bureau, Mr. Shizo One, One for his opening remarks. Over to you, sir.
Excellencies, Osamu Yamanaka, Ambassador of Japan to the United Nations, colleagues and friends. Good morning, good afternoon, and good evening. It is a great pleasure to welcome you to our discussion today. I am Seizo Onoe, Director of Telecommunication Standardization Bureau of ITU. I thank you all very much for joining us, and I extend my appreciation to our co-organizers, the Permanent Mission of Japan to the UN Department of Economic and Social Affairs, and the World Health Organization. Digital transformation is a key to our ambitions for a sustainable future. ITU standards now support digital transformation in areas including energy, mobility, healthcare, financial services, agriculture, and the creation of smart cities and communities. Our standards are also helping everyone to capitalize on advances in AI and machine learning. Our dependence on digital technology is reaching new heights, and that's exactly why ITU members work together to connect the world and ensure that our interconnections makes meaningful contribution to society. Beyond connectivity, we must ensure that the digital services speak meaningfully to our needs and are user-friendly for everyone. Our health systems are evolving to support our aging populations. Digital health services are playing a key part in this evolution. But our health and happiness rely on much more than the access to healthcare. Some say that the secret to a long life is being surrounded by people you love. Meaningful connectivity is essential to full participation in a modern life. This highlights why meaningful connectivity is such an important guideline for our work together at ITU. ITU standards for medical grade digital health devices, such as connected blood pressure cuffs, glucose monitors, weight scales, and a wide range of activity trackers, and helping prevent and manage chronic conditions such as diabetes, hypertension, and heart diseases. ITU standards for accessibility are helping the elderly to cope with waning eyesight or hearing, and stay connected with friends and family as movement becomes more difficult. And to help AI and trust and healthcare professionals, ITU and the World Health Organization are developing a benchmarking framework to support developers and regulators in certifying the AI solutions as is done for medical equipment. ITU's commitment to older persons also means developing a range of resources such as toolkits, training courses, and reports. We have also been strengthening this important topic as the WSES Forum through our initiatives such as the WSES Healthy Aging Prize and its special tracks on ICTs and older persons in collaboration with our partners. We are delighted that this activity has been recognized in the General Assembly resolution entitled Follow-up to the Second World Assembly on Aging. As we innovate in the interest of healthy aging, we must ensure that innovation benefits everyone around the world. The inclusive ITU standardization platform can help us to achieve that. International standards help us to share new technologies and their benefits worldwide. But impactful standards are the result of strong will to come together and build consensus on the way forward. Our standardization process ensures that all participants' voices are heard, and I urge you to make your voice known. ITU supports developing countries in increasing their participation in our work and maximizing the benefits that they draw from the standards. We also offer reduced membership fees for academia, startups, SMEs, and companies for all sizes in developing countries. I welcome you to join us. Thank you.
Thank you very much, Onoe-san, also for highlighting the role of standards, capacity building and training, and also the importance of all our efforts being recognized in the UN General Assembly, the resolution you mentioned, and the importance of the different emerging trends in the area of aging that is enabling older persons not only in the area of health, but also to lead a better life. Thank you so much, Onoe-san. I would now like to move on to His Excellency Yamanaka, Ambassador. Sir, over to you.
Thank you. Thank you for the floor, Ms. Gitanjali. And I'm Osamu Yamanaka from the Permanent Mission of Japan to the United Nations in New York. So good morning and good afternoon and good evening. First of all, I'd like to thank the ITU for leading the planning of this side event. Japan has been working closely with the ITU to achieve universal connectivity and sustainable digital transformation. The Permanent Mission of Japan is honored to co-host today's event on ICTs and older persons, together with the ITU, WSIS, UNDESA, and WHO. I'm also pleased to meet online for the first time with Mr. Seizo Onoe, the new director of the ITU's Telecommunications Standardization Bureau. I would like to emphasize that we are ready to continue to work closely with ITU under your able leadership. Aging is an important topic on the global agenda as the number of older people is growing at an unprecedented rate. There's no doubt that aging is a major issue in Japan as well. As of 2021, of the total population of Japan, around 30% are aged 65 and over. In 40 years, we expect that 1 out of every 2.6 persons will be aged 65 and over. As one of the world's super-aging nations, Japan faces challenges in sustaining economic activities, social security systems, people's daily lives, and the local communities, which can no longer be addressed by conventional policy approaches. To address these challenges, we focus on researching and promoting the active use of ICTs to improve the quality of life of the elderly and to improve care services. Today, we look forward to hearing the experiences of all the panelists. Ms. Masumi Ono from UNDESA, and Dr. Ansh Banerjee from WHO, Mr. Charles Bark from Hainunu, and Ms. Tafazwa Musha from the University of Zimbabwe, and Mr. Michael Hojin from Global Coalition on Aging. And we look forward also to feedback, having a feedback from the floor as well. We also warmly welcome Dr. Kenyu Nishimura who generously accepted our invitation to join today's event from Yamaguchi Prefecture in Japan. Dr. Nishimura provides online consultations for the elderly in rural areas and remote islands in Japan. And we are eager to hear about his tireless efforts in this field. I hope everyone will enjoy today's event, and thank you for your attention, Ms. I will return the floor back to Ms. Tanjani.
Thank you very much, Excellency Yamanaka. Thank you to Japan again for sponsoring such an important issue. ICTs and older persons. Our goal is to ensure that we can highlight the cross linkages of ICTs and older persons with all the different components of information and communication technologies and the sustainable development goals. So thank you very much, Ambassador. I would now like to move on to Ms. Masumi Ono. She's the Chief of Social Inclusion and Participation Branch, UNDESA. Welcome, Madam. What are the opportunities and challenges of aging societies in a digital world? And how is the international community addressing them? Over to you, Van.
Thank you. Thank you so much for the questions. I want to begin by saying that global aging should be embraced as an achievement. Higher age groups have skills, experience, and resources, and this has been recognized as an asset by the international community at the Second World Assembly on Aging. 20 years since its adoption, the Madrid International Plan of Action on Aging still resonates strongly today. MIPA highlighted actions for achieving full inclusion and effective participation of older persons in their communities and to the development of their societies. And digital technologies can serve as an enabler to this end. You asked me about opportunities. Harnessing digital technology can bring many practical socioeconomic and health benefits for older persons. For example, through the use of digital applications for medications, assistance in triage assessments, caregiver monitoring needs, and preventive health behaviors, just to name a few. Innovative technologies for farming, personal financial management, and remote work can also empower older persons financially and professionally. However, as you rightly asked me about challenges, digital inclusion of older persons, particularly since the pandemic, face issues in digital literacy, access to information, age-based stereotypes, connectivity gaps depending on gender, income, location, education level, and age. And these multiple factors overlap and lead to greater discrimination and inequalities. What we need to do as international community to embrace the full digital inclusion of older persons, the diverse needs and preferences of older persons must be met. Digital products, policies, and practices must comply with human rights principles and standards to protect older persons online and offline globally. Together, we need to address discrimination, structural, and institutional barriers head-on. In this regard, DESA is proud to be working side by side with ITU and WHO within the framework of the Decade for Healthy Aging. We've raised the profile of older persons at the World Summit on Information Society, including through its special track on ICTs and older persons. We're confident that the investments in this area of work will bear fruit, judging from the growing interest from all relevant stakeholders, including older persons, the private sector, non-governmental organizations, and academia. To sum up, digital technologies hold the promise of innovation and opportunities to build better societies for all, but they also pose significant challenges. Governments and policymakers need to be mindful about the short and long-term consequences in the digital space, especially as they affect social groups that already face discrimination and exclusion. The aspirations of the 2030 Agenda cannot be achieved without reaping the benefits of longevity. A life course approach is needed in national strategies and policy development. Opportunities that open up through digital technologies should be used to promote a healthy, active, and engaged life for older persons and a society for all ages. We look forward to transpiring innovations and actions through today's discussion and at the forthcoming World Summit on Information Society Forum 2023. Thank you.
Thank you, Ono-san. It's really a pleasure to hear you talk about the different initiatives in UNDESA. We are very familiar with those initiatives because we work closely with UNDESA. However, many of the audiences, more than 50 participants who are with here today, are basically here to listen about what the UN, in collaboration with other stakeholders, is doing to implement ICTs for older persons. So thank you very much for sharing all those case studies and innovative activities by UNDESA. I would like to also introduce my co-moderator, Mr. Vladimir Stankovic, who will also introduce some activities that ITU is carrying on. But before that, I would like to invite Dr. Anshu Banerjee, Assistant Director General ad interim, Division of Universal Health Coverage, Life Course, WHO. Dr. Banerjee, welcome to the WSIS session. In your opinion, in what ways do digital technologies help older persons maintain their health and remain active? And in your view, how do you see the roles of ICT in improving universal health coverage for older persons? Over to you, sir.
Thank you, Gitanjali, and it's a pleasure to be part of this session. Today, at least life expectancy is at least 50 years in all countries, and so population aging is inevitable for most countries worldwide. Hence, there is a greater need to support present and future generations in healthy and active aging. And fortunately, we're all aging in this digital era. Many digital tools are available today to help older people live longer, maintain active and healthier lives, and contribute to society. Numerous apps, sensors, and other kind of wearable devices are available today to help older people maintain physical fitness and monitor their vital signs. These devices use algorithms to analyze data on exercise and provide feedback to improve performance. But also we have dieting apps that provide the caloric values of food items that people take and that help them to either lose weight or maintain their body weight, and help them to also plot, let's say, trends over time. And although these digital innovations are promising, many older people still lack access to them. As during the COVID-19 pandemic, we've seen that digital services, including telehealth and banking, for example, became increasingly the norm. It also highlighted that access was a challenge to older people, as older people use digital technology at lower rates than younger people and often struggle with it because it's going too fast and they can't cope with the speed. And this is unfortunate, as older persons could benefit much from digital technology. Therefore, in the coming years, we must ensure policies and programs are in place to narrow the digital divide and increase the digital literacy of older persons. Coming to universal health coverage means that all people can access the full range of quality health services without financial hardship. It covers the full continuum of essential health services, from health promotion to prevention, treatment, rehabilitation, as well as palliative care across the life course. And for older persons, the access and coverage of integrated health and long-term care services are key to achieving universal health coverage. More importantly, the care services should be offered based on what their physical capacity is, their intrinsic capacity, as well as how they have been able to adapt within the environment, so their functional ability. And this is determined by person-centered assessments and should be determined by person-centered assessments and not by chronological age. For example, the WHO Integrated Care for Older People, or ICOPE, digital tool guides health and social care workers through screening older people at risk of care dependency in the community and through undertaking a person-centered assessment of their health and social care needs. This assessment then facilitates the development of a personalized care plan. Another example is from Thailand, where the country's 3 separate healthcare schemes covering the older population, as well as public and private sector employees, are connected and managed through one unified ICT system. So when an older person accesses healthcare services in any of the facilities nationwide, medical staff can automatically access data on the older person's profile, the person's medical history, as well as the insurance type via a microchip that is embedded in his or her identity card. This supports healthcare providers in better decision-making for treatment, reinforces quality and safety in care, and enables hospitals to provide an effective, efficient, and equitable service. ICT therefore can help address inefficiencies in the health system and ensure that we get more health out of our investments. To conclude, the advancement towards universal health coverage for older persons is both technically possible and economically feasible, and it can be accelerated with the support of digital technologies, but political commitment is required to make this a reality. Thank you.
Thank you, Dr. Banerjee. Thanks for this input. And to all our speakers who have spoken before, we look very much forward to be working with you, collaborating on this important topic. And on my behalf, I would like to present some of additional work that ITU has been contributing to this very important topic in the past years. As you may know, this has been on a very high agenda for ITU, and the World Telecommunication and Information Society Day that was celebrated last year was actually covering this particular topic, the digital technologies for older persons and healthy aging. In addition to this, ITU has been working, and in line with the UN Decade of Healthy Aging, has been working with lots of different communities, and in the development sector has produced a lot of reports and sessions organized. Some of them that I would like to mention include those of ITU's 2021 Aging in Digital World report that addresses the nexus of digital technologies and steadily aging populations, but also reports on Be Healthy, Be Mobile, a handbook to how to implement mobile aging, consolidating information for implementation partners wishing to establish mobile health for non-communicable disease projects proven to be Healthy and Be Mobile framework. We've been working with our colleagues from WHO and UNDESA on social isolation and loneliness among older people, as well with other UN agencies, some of them, just to mention the UNEC discussions, including the 14th meeting of the Standing Working Group on Aging. So on and so far, one of the major work that ITU contributes to as part of the WSIS process and WSIS forum, as my colleague Gitanjali mentioned, is also through the special track on ICTs and older persons. And we continue to do so again with other stakeholders, some of them being present with us today at this meeting, that I would like to comment and thank and appreciate the Global Coalition on Aging, our colleagues from UN agencies, World Health Organization, UNDESA. Thank you very much, but other stakeholders as well who are involved in this topic have really been pushing this special track on to such levels that we have in the 3rd edition of the special prize, recognizing how technologies, innovations can help healthy aging. 2 years ago, we held a special hackathon developing solutions that could help better aging. And this year's we are also preparing, and we'll be presenting a series of workshops, sessions on how to further use technologies for this important topic. In addition to this, we are working through intergenerational discussions and dialogues, really trying to get everyone on board to understand and better discuss how these things can be further developed. On behalf of ITU, there is plenty of more that I would like you to invite you to explore on our websites. And of course, the WSIS Forum 2023 website and a dedicated page to the ICTs and Older Persons track. A bit from my side, but now it's time to move on with our respective speakers. And the next one I would like to invite is Mr. Nishimura Kenyu, doctor of Yamaguchi Prefectural Grad Medical Center. Welcome, sir. We have two questions for you that we would like you to address. And the first one is, how can ICTs support healthy aging? And the second one, how can we ensure digital inclusion for older persons? Please, doctor, can you?
Yes, thank you. Thank you for asking me. And thank you for inviting me to this session. I really appreciate this opportunity. I'm going to show my presentation slide. Can you see the slide?
Yes, please go ahead.
Yes.
Yes, thank you. I'm talking about video consultations supporting elderly in rural areas and remote island. I'm a medical doctor and I worked these rural areas for 10 years. Background: it has been more and more difficult for elderly in rural areas to reach medical care in familiar environment. Telemedicine has been expected as good alternatives. Guidelines developed to use video consultations more easily, but few effective use, particularly for elderly in the rural areas, was reported. We have researched how we should use video consultations to support elderly in rural areas effectively and expand the use safely there in Japan. The community-based integrated care system is a structure promoted establishing by Ministry of Health, Labor, and Welfare of Japan for elderly to live in their own ways in environments familiar to them, even if heavily in need for long-term care. We have aimed video consultation to improve access to medical care for elderly in rural areas and be useful as one of important roles to promote establishing the structures. Before we studied video consultations in Yamaguchi Prefecture, we visited and observed video consultations in rural area of Oregon, US. And we introduced these areas in rural area of Yamaguchi Prefecture. I worked there and I opened the clinic in this area 4 days a week, and I provide video consultations from clinic or other places with nurse supporting for unplanned consultations while the physician was not in the clinic. So in remote island Aishima, so doctors go there once a week to see patients from our hospital. So we provide video consultations with no medical staff supporting as alternative when physicians cannot reach there because of bad weather. In remote island Hashirajima, doctors go there and to open the clinic 2 days a month, which is decreasing. So video consultations is provided with nurse supporting to keep frequency the clinic opens. In remote island Heigunto, So the clinic opens 3 days a week by part-time physician who is not live in the island. Video consultations is provided with nurse supporting as alternative when physician is absent. So we could keep increased access to medical care for elderly in rural areas by video consultations, supporting by nurses and others let them receive effectively medical care through video consultations. It was important to get more information from nurses in advance. Nurses could also help physicians providing care to patients. So in conclusion, although it has been more difficult for elderly residents in rural areas to have medical care in environment familiar to them in Japan, video consultations can improve their access to medical care and can promote establishing the community-based integrated care system. Nurses and others supporting beside the patient are important, particularly for elderly, to have video consultations appropriately and safely. Thank you for your attention.
Thank you, Dr. Nishimura, for providing this information from the ground. This is definitely something that we are trying to collect and present to the rest of the community. One of the ways to collect information, at least for the VISIS process, is through the VISIS stock taking. It's an international repository of more than 14,000 entries since 2004 when we have launched this. And we do look forward to receiving your submission as well, not only to a global report, but also as an opportunity to be further promoted and awarded for the good work that you do through our VISIS prizes. One such particular initiative started also together with our stakeholders who are pushing for the good use of ICTs and healthy aging. And this was launched, as I mentioned in my previous statement, 3 years ago, together with our dear stakeholders through a special prize called the VISIS Healthy Aging Innovation Prize. And today with us, we have one of the winners, actually the current winner from the 2022, Mr. Charles Bark, CEO of Hainunu. Welcome, Charles. It's been a while since we met. Hope everything's fine at your side and that you are looking forward to our upcoming selection process for the 2023 prize winner for this particular prize, being a part of the jury as the 2022 winner. Charles, Hainunu was awarded as the prize for this special effort for healthy aging through ICTs. How you think e-health solutions such as your patient digital twin promote healthy aging? And also, how can artificial intelligence be a solution for the shortage of senior caregivers and leverage healthy aging without increasing the digital divide?
Thank you. It's a real pleasure to be with you again today. And it's an honor to have been selected as this award winner in healthy aging by you fellow high-level expert in the world from UN, from World Health Organization, Global Coalition on Aging, and be able to share our innovation in the WISIS Forum. We have been lucky in a sense that with our innovations today, we are able to bring more preventive care and visibility at home, because in fact, our innovation was based on my personal failure, because I am the third generation working in healthcare in my family. And the problem that I had 10 years ago is my mother, who is a retired doctor, was living far away from me, and I was calling her and I said, "Hey, mom, how are you doing?" She said, "Yes, I'm fine, don't worry." But then my older brother called me and said, no, she's not fine. She fell down and went to hospital. And then I realized that we didn't have any visibility of a health at home, and all our good parents are lying about their real situation. And when we know, it's already too late. So the issue was, how is it possible to deliver a care when it's not too late and expensive. So that's come the idea of doing some research in US, Canada, France, and China to be able to understand how is it possible to be in preventive care rather than cure, which is today's existing healthcare system, which is too late and too expensive. And so if we are thinking of preventive care, we have to think of data, because there is no prevention if there is no data, especially at home. But the big question is, if today we have to take care of our elderly parents who are living far away from us, where do we get those data? So Hainunu developed what we call a home wellness kit that is combining different kinds of medical connected devices with different sensors that are able to collect some relevant data at home and bring the visibility and the clear picture of the situation of our elderly parents at home when we are not close to them. And so what are these kind of data that we are collecting? We are collecting 5 dimensions of data that what we call a digital twin. So data about the past, which have a DNA test that include the top 12 susceptibility risk of chronic diseases, cardiovascular disease, hypertension, and diabetics. Then we have a medical connected device that collect metabolic data. And then we have also environment data, mental data, and behavior data. So 5-dimension data is our digital twin. And then we have AI algorithm that analyze those data and give us a better quality of life for the senior living at home. Because our aim with this algorithm that score the risk of diabetes, hypertension, and cardiovascular disease at home is to help the seniors not only to live longer, but to live healthier and happier at home. And because our platform and the super app is patient-centric, we are able also to follow the full patient journey and also to connect the right stakeholder coming from healthcare, senior care, and also insurers. And this is what we call AI for good. It makes a possibility for the professional and their family to be able to connect different stakeholders. When you ask me the question about how is it possible to reduce the digital divide, we have to think of making AI with a mobile health very simple to use, because most of them, 80% of the 1 billion senior living in a low and medium income country. And as a designer of e-health solution at home, we need to think of usability, make it simple. So in Hainunu, we make audio guide, built in our app. So for them, when they use connected medical device, they don't need to read a heavy user guide. They have audio guide in their language that will guide them step by step to use a medical connected device. And because 60% of seniors live alone, we help and facilitate the connection between the seniors, the family caregivers, and also the professional caregivers, wherever they are. Because if we help seniors in African country, in low and medium country, we are able also to connect some of the doctors living in much developed country to be able to address the inequality of health, not only in the south of Africa, but also in Southeast Asia. That is what we are aiming to do with our AI. AI for good, centered to human, and accessible to everybody, not only to the rich country, but to the south.
Thank you, Charles. It's been very inspiring since knowing you, being exposed to the work you do. I think all of us here today are, we're brought together to celebrate and to be present in what the present really is providing to us. That we discuss about these emerging technologies on helping us age better and well, and helping our communities from senior citizens to others. really an impressive way of the progress that societies around the world are experiencing. And we do hope that your example will be seen, noticed, but also replicated elsewhere. This is why we are actually going through all these different processes, trying to really get as many good and best practices around the world so that we can share it with others and sparkle some partnerships and further collaborations. So many examples that we have heard today from the ground. Another one will be better presented by our next speaker, who is here to present the winning theme of the WSIS Forum 2021 Hackathon, titled Aging Well with ICTs, Mr. Tafadzwa Musha from the University of Zimbabwe. Madam, welcome. Despite the frantic efforts to ensure digital inclusion for older persons to support healthy aging, there are other elderly persons who are at risk of exclusion from ICTs. What could be the possible factors that contribute to the exclusion, and how can we address these factors in order to ensure inclusion to all? The next question I would like to pose to you, Madam, is as the WSIS Forum 2021 winner, hackathon winner, can you please share with us your innovative project on a smart walking stick, and what could be done to encourage more innovations in healthy aging?
Thank you for the platform. It's a pleasure to be participating on this platform, and it's also an honor to win the 2021 WSIS Hackathon. So despite the frantic efforts that we're putting to ensure inclusion for all elderly people, there are also others who are at risk of exclusion in terms of technology. So life expectancy is on the rise due to advances in healthcare. And on average, people are now living longer globally. And the population of the aged people that are 65 and above is estimated to double by 2050. But unfortunately, looking at a continent like Africa, nearly half of the population still lag behind in terms of technology. So there are several factors that are causing this exclusivity in technology. Some of these factors are technology complexity. Some of the technology are too complex for the elderly people to use. For example, the mobile phones that we're using nowadays have got touch screens, which may be difficult to use for the elderly people. There is need for usernames and passwords, which is also difficult for elderly people to understand. And some other interfaces can be difficult for elderly people to understand as well. So, and also illiteracy. So looking in Africa again, about 30% of the sub-Saharan Africa population is computer illiterate. So looking at the older population, well, with my generation, we are more illiterate than the elderly people who are living in, especially in Zimbabwe nowadays. Most of them did not have access to go to school, so they are computer illiterate. They do not even know how to use computers or cell phones. So there is need to educate these people, and also there is need to raise awareness and access to technology. And also there is need for organizations like WSIS, GCOA to maybe expand to continents like Africa in order to raise awareness, to help us to raise awareness. Other factors include disability. This is where we come with creations of assistive technologies. For example, visually impaired people may have difficulties using technology, people who've got cognitive disabilities. So at the University of Zimbabwe, together we are working on other new projects besides the smart walking stick that I developed for assistive technologies to help elderly people, even the disabled people. And another factor which contributes to exclusion in technology to the elderly people is ignorance. Some people do not even know the importance of technology, especially people who are living in the rural areas. They do not even know that there is something called technology. They do not know the importance of technology. So there's also need of raising awareness and explain to people and teach them what the importances of technologies are. And also, most of elderly people in Africa are low-income people. So mobile phones and gadgets that give them access to technology could not be affordable to them sometimes. And also locations in Zimbabwe particularly, there are other rural areas which do not have internet access. There is no electricity, so there is no possible way that people who are living there can access technology. So there is also need for government intervention to provide electricity to the rural areas and to provide internet access. And also there is language barrier. I'll keep on giving examples of countries in Africa. Most countries in Africa, our main language is, okay, for most countries, their main language is not English. Some use their native languages. And when we look at technology, most gadgets use English. So for some people, it will be difficult for them to understand. So we have to develop devices that also use native languages to allow everyone to understand use of technology. And also in Africa, data is expensive as compared to other continents. So there is also need for government intervention. And because of our network infrastructure, our data are really expensive. And also there are geographical restrictions that also contribute to exclusion of technology to the elderly. Countries with low economic development lack technology and infrastructure that is necessary for high-speed internet connections. And also because of this, the government has a big role to play to allow inclusivity to the elderly. So in terms of complexity of technology, I was looking at a device called KOMP that was developed in the UK. It's a one-button computer, very easy and understandable to be used by the elderly. So it's linked to an application that is used by that elderly person's close relatives. So the way the elderly person uses it is it has one button. The person presses the button if they want to switch on the device. As soon as they press on the button, as the tablet turns on, the relatives are informed. They can make video calls, share pictures, etc. So, I mean, it's not complex in the sense that it does not have a touch screen. It's only one button. If they turn it on, their relatives are able to communicate with them through videos and sharing of pictures. If they do not want to communicate at that particular time, they simply turn it off. It has a big screen that they can easily see. So I think there is also need to develop more of these and use it wide. I mean, use such devices wide in other countries. So to answer the second question, so I participated in the 2021 WSIS Hackathon competition themed ICTs and older persons, and I developed a smart walking stick. So this smart walking stick is based on obstacle detection. So it is used by the elderly people who are visually impaired. It detects obstacles, waters, and all above obstacles in front of them. It is connected, and then it gives them feedback to alert them if there is an obstacle in front to avoid collision. And it is also connected to a web application, into a mobile application that allows the users' close relatives to monitor their GPS live location at any given time. So this is where we were when we participated in the WSIS 2021 Hackathon, but we also went on to modify the walking stick. So it now has an SOS button, a panic button, and we are actually still working on modifying the project. So the project is at commercialization stage currently in Zimbabwe. We are expecting to start selling this product in about 2 to 3 months time from now. And we're also planning to even expand to sell the product to other countries. And besides that, there are other products, especially assistive devices, that are also on their way. We are still in production stage. Thank you so much.
Thank you, Tafadzwa. This is very exciting to hear. We look forward to that launch. Please invite us if we can virtually at least be present. And then, of course, we would like to further promote the progression on the winning project, and really expose it also here at the WSIS Forum. As you mentioned, we're still looking into solutions that need to be redesigned, readdressed to reach out to all communities, including seniors. I do understand the pain that some of our senior citizens are going through with perhaps unnecessarily complicated computers in comparing to the one that you were describing from the colleagues in UK. But also to have this, as you mentioned, we are still yet to connect to internet 50% of the planet and provide them with basic infrastructure to use technology and therefore connect with the rest of the world. Of course, there is new technologies that we are learning about that can help us also translate into different languages. I'm sure you know that we are only at the beginning of something that will be seen as the greatest tool to help healthy aging and serious citizens. We again appreciate your presence and would like now to invite our next speaker, who has been very well known to the WSIS community and beyond for the work they do, Mr. Michael Hoden, CEO of the Global Coalition on Aging. Welcome, Michael. Welcome back to the WSIS Forum. We've been working so much for the past in the past period. You have been a great partner for the overall WSIS Forum, especially helping us enhance the special track on ICTs and older persons and beyond that. There's just an endless way of introducing how we have collaborated together. But perhaps you can tell us more from your side and just adding to the discussion of Tafadzwe and the difficulties that we have. We do need to learn more on how the businesses can find a solution that can be bridged for these public and private partnerships, or just find interest into developing technologies for those in need. So from a business and private sector perspective, if you can name 2 to 3 greatest opportunities at the intersection of technology and older persons, what would this be? And also, what are some of the most exciting innovations the GCOA sees in the technology and healthy aging space?
Thank you, Vladimir, and thank everyone. It's a delight and a pleasure to be here. As you indicated, and it's been referenced a number of times over the last hour or so, Global Coalition on Aging is a unique organization. We are private sector, large, for the most part, businesses across sector. So the Philips of the world, the Pfizer's, the Merck's, the Novartis in the healthcare side, Bayer, Gilead, et cetera. On the financial services side, Bank of America, Aegon, the insurance company based out of the Netherlands, Elder Care, Home Instead, based out of Omaha, Nebraska, and interestingly, about a year ago, bought by a technology company, which is itself another very interesting story. And we've been delighted, Vladimir, as you and many others have said, to be working with you for the last 3 years. I think we originally met at our Global Silver Economy Forum, which we held in Helsinki in 2019, pre-pandemic. Who would have known at that time? And together we helped to craft this new effort on the track for ICTs and older persons. So to your points and your questions, let me back up a little bit. First of all, also to congratulate Charles Bark, a friend and the winner of Healthy Aging Innovation Prize. The winner in the prior year, Ian Philp, who has Aged Care Technologies, which, to relate to Dr. Banerjee's comments, particularly on integrated care, they have a technology-related assessment tool for older persons, what matters to the older person themselves, and putting that through a whole technology structure, which I think is a great innovation. Charles, I think your innovation is fantastic. And one of the things we learned at Silver Economy Forum, not only in Helsinki, but the one we held this past November, is that this $17 trillion marketplace, the silver economy, is a great opportunity no matter what business you're in, no matter what sector you're in. We've heard a lot about healthcare today, but it goes beyond that to transportation. Uber is now involved, mainly through their several of their work on how they engage even better with older adults. How do we move to the place where we bring in housing, for example? We truly make a transformation from the hospital or even the doctor's office as the center of healthcare, which, as Charles Bark mentioned, is largely built on the acute care model of treatment as opposed to prevention, building technology into the home. And again, not only in the healthcare side for older adults, but on life in general and happiness. What is the relationship with streaming, with purchasing? And how do we work with all companies, not just in the healthcare or technology sector, but in the distribution, the consumer, a Walmart, an Amazon, for example, in their global distribution efforts. You know, one of the points I thought I might allude to here, Suze Onoe, I may pronounce your name, mispronounce, and I apologize, but you opened up by talking about health systems evolving to support an aging society. And of course, Japan is at the leading edge of that. I would add to that phraseology to say that health systems are evolving to support our aging society so that an aging population can provide economic, social, and productive engagement to society. And that goes back to the point that this global aging dynamic is really about two things. It is longevity. We are all living longer. A young girl born in the late 90s in London, hopefully that will become true in Zimbabwe as well, Mushu, will likely see 3 centuries. This is never even contemplated in the history of humanity. So longevity is there, and as we get older into our 70s, 80s, 90s, there are different kinds of needs in a variety of areas that technology is critical for. But secondly is population aging, which is more old than young. And that's really critical because it's this issue that the society itself, Japan knows because you're at the leading edge of this, but it is true across all OECD countries, and increasingly over the next few years will be true everywhere as every society modernizes, of more old than young. And so the enabling through technology of our lives as we age is not only for an older person or an older population, it is for all of society, particularly when the older population is the larger proportion of that society. Innovation is critical. We need the support through intellectual property, through markets, of enabling innovation of the sort that Charles Bark talked about, winning the Healthy Aging Prize. We now have about 155 submissions for this year. It's up about 30% from almost 60 countries, every continent. It's really becoming quite extensive. I would remind us that we talked a lot about cardiovascular health, for example, diabetes, for very good reasons. We all know the challenges around Alzheimer's. But there's also areas like bone health, osteoporosis. Charles, you referred to your mother who had a fall. She probably had osteoporosis and a fragility fracture. If we can, through technology, understand bone density and understand osteoporosis better, bone health better, and avoid that second fracture, this will not only be good for healthy aging, but it'll save us a lot of money. Let me conclude with another thought here, and it relates really, Mushu, to Musha, I apologize, to what you highlighted. You know, it is true that we want to make sure that older persons have access to technology that can be used. But I would remind us that as we get older, a 60-year-old, a 70-year-old might be a little different than a 90-year-old or a 100-year-old. Maybe yes, maybe no. But, you know, today a 75-year-old is likely to have had a BlackBerry and a computer 30 years ago. I mean, certainly in the OECD countries, and increasingly that will be so. So one of the things that we misunderstand about an aging society is that we put 55-year-olds with 98-year-olds in effect. And that doesn't really work. So let's think about how complicated this is, how complex and how diverse. And very soon, 35-year-olds and 45-year-olds will be 75 and 85. So it's in all of our interest to understand technology for a healthier aging. The idea that we have the decade of healthy aging is fantastic. All the partnerships around that. So we're delighted to be part of that and bring the business voice to that and encourage all of you to think about the right kind of market conditions, intellectual property, the support for innovation so that we can conclude this kind of decade that we have now through the decade of healthy aging on a positive note for all of our, not only older people, but our children and their children who will soon be 70 and 80 themselves.
Thank you, Mike. Thank you so much for your intervention, for reminding us of doing all we can from various angles with different communities on discussing such an important question, especially with the better use of technology. We are all there to contribute to this UN decade on healthy aging. And as we can see, all this input coming from different, communities, stakeholders, may be crucial to the other ones who will learn about it and be able to replicate and, go through some collaboration, implement. This is exactly the purpose of today's session, as many other sessions that we are covering on this topic at the VESIS Forum, but also in all our respective agencies, wherever we can, we are looking into raising and amplifying the voices of these communities. I have mentioned some of the work that ITU has done in this regard, but one of the first ever reports addressing how technology can help this community was launched a year ago, and it's called Aging in Digital World, from Vulnerable to Valuable. And as we can see how this different kind of vocabulary even is using, a word valuable really, hits the point here. As you mentioned, all of us can contribute greatly to a common cause. And this is what we should be looking into promoting further. Thank you again. And thank to all the speakers that we had today. We still have a few minutes left for the question and answers section. And I would like to raise one that we have received from Anupam Padney, who is asking, and any of you are free to respond to it, or all of you, what sort of efforts required to ensure care economy for older persons? Bearing in mind mental health and living environment are key aspects to make sure sustainable lifestyles. What would you like to respond to this? What is your understanding and notion of care economy? And what do you think the efforts should be? Please, if anyone would like to respond, just raise your hand. I have Charles. Go ahead, Charles.
Care economy is a wonderful question. Is how is it possible to make innovation in technology affordable to all, not only for the rich people, but also for those who live in low and medium country? It's all about bringing, as Musha said, because the buying power is low, we have to rethink of a business model, not only a technology per se with innovation, but how, when we design this innovation, how can it be affordable to many? And in Hainunu, we think that the perfect business model will be SaaS, software as a service. You just pay the usage, not the hardware, at $1 per user per month. And so you deliver like a Uber or Airbnb, you just deliver the usage. They don't need to buy the apartment or the car. They just use the IoT medtech and the sensors, and they just pay for $1 per user per month to increase the accessibility for all and to fight against health inequality.
Thank you, Charles. Anyone else? Mike, please go ahead.
Thank you. So it's a great question. I would suggest a few ideas. One is that for successful care economy, we need to focus more and more on prevention. The acute care model is something we built under the communicable disease ideas, now with diseases of aging, and we've mentioned several of them today. Predict and prevent is where we have to get to as kind of defining the care model. Secondly, that we expand the roles that we think of as involved in care from the professional healthcare provider, who is utterly essential, the nurse, the doctor, et cetera, to caregivers. And thirdly, that we think about shifting the place where care is provided from, quote unquote, the hospital or the doctor's office to the community and the home. And again, technology can think of the technology built into the home for the future, or built into the community, where we track our steps, where we have access to all sorts of interesting innovations of the sort that Hainunu is now providing. So those are three ways to think about it in terms of the care economy and care models for the 21st century.
Thank you, Mike. Thank you all for really being active here today, of sharing the input, examples, good examples of the good work that various communities are doing. And I'll be closing with another point raised today of how can we connect our communities? How can we better, work together on this? One way is to use the existing platforms. I do believe VISIS Forum is one of them, being a multi-stakeholder platform to discuss all these different topics on ICTs, including healthy aging and older persons, but also contributing to the UN Decade on Healthy Aging. This is also something that I see as a great platform and momentum that we should be all looking into, and perhaps try to communicate all our doings and work within the various communities on that platform as well. So if I may, just in a closing, first thank to all of our respective speakers today, including Dr. Onoe from the TSB and Japanese ambassador who was also with us, other colleagues from the UN agencies, those through the VISIS Healthy Aging activities that were also together here with us today, for all their presence and input. And I would like to use this opportunity in the closing to invite everyone to join us at the VISIS Forum in March, taking place from 13th to 17th here in Geneva. An exciting program is being prepared, and we do invite you to contribute, actively participate, and see how we can further shape the agenda on this particular topic in the future. So once again, thank you all for being with us, and we look forward to be working with you.